Hey Robin, how's it going? How's it going?
Good, George. How you doing?
I'm super excited. It's always a pleasure being able to get together with you for these podcasts. And then today, we have the pleasure of having two wonderful guests. I'll give you the floor so you could give them an introduction.
Oh, it is my honor. I am very excited. I love having guests, and I'm so excited about what we're going to be talking about today. So, I would like to introduce Dr. Jacques Jospitre, who I call
Hello,
Dr.
hello.
J. Hello and welcome. And this
Thank you.
is also Dr. Peter Bongiorno, who I've started calling Dr. B recently, and I haven't asked whether he minded or not, but I'm doing it. So, welcome to our podcast. Thank you so much.
Thank you. I like whatever you're comfortable with, Robin.
Thank you. I like that. I feel like the world should be like that. So, today, our topic is about seasonal affective disorder. So George and I had been talking about it because it seems to be coming up more and more now, which is pretty common around this time of year, the change of the clocks. I was talking about it because I never noticed for myself any kind of mood impact or anything with it being dark so early. But this year, I am definitely struggling with it being dark at 4:30. So we have a series of some questions, and we'd love to hear your take on it and also about maybe some treatments and naturopathic treatments. So maybe one or both of you can just start out by explaining what seasonal affective disorder actually is.
Yeah, I can start. I mean, seasonal affective disorder is, it comes from tracking your mood, right? And seeing like, how do you feel each day? And then people noticed that there was a pattern where over the, late fall, winter time, that their mood would consistently go down at that part of the year. And so that connection between the mood and the season is how we came up with that diagnosis. And then it begged the question of what's the connection? Is it the cold? Is it the light that's causing it? And then, the different thoughts around that.
To maybe to carry that a little bit further, as science looked into this clear connection between mood and the time of the year, they started noticing that light seemed to play a strong role. And what we learned is that light affects the brain and affects the central nervous system and affects the level of serotonin in the brain. Serotonin being the molecule that is part of, a number of different neurotransmitters in your brain that help you feel happy. And what we learned is that during that time of the year, serotonin naturally does go down. And I guess when you think about it from a nature standpoint, we're animals. Animals are meant to somewhat hibernate in the winter and not get up and out as much as we often do, and especially we're often asked to during times like the holidays. And so I guess maybe Mother Nature decided that we didn't need as much serotonin back then. And given that the light changes and the angle of the light changes, there's more of a deficiency there. So it's possible that some people who are already on the low side and who are already predisposed to maybe not feeling so good, that will affect them versus maybe other people who otherwise aren't affected.
Yeah. And I also, I think of depression as also being tied to a low energy state. And so that feeling, one of the symptoms of being depressed is feeling heavy and, having lack of motivation. And so it kind of fits with that notion of hibernating. But things that tend to kind of drop your energy level, I think, can make people feel down. And things that kind of boost up the energy can also help you feel, better, help you feel up. And there is a link between the light and just not just serotonin, but also melatonin because serotonin also helps link into melatonin, and all that affects your ability to sleep properly and just stay in your normal cycle. And a lot of feeling good is about maintaining healthy cycles, and so that gets thrown off, and then you just kind of feel off. And then we can talk about different ways that we get people back onto a good healthy cycle.
Yeah, when I over 20 years ago, I trained in Seattle, which is where I did my medical training in naturopathic medicine, and in Seattle, as you may guess, there is a lot of seasonal affective disorder. In fact, the first year I was there, because I moved from the East Coast from New York, and when I moved to Seattle that first year, there were over 100 days without any sun that actually peeked out through the clouds.
Wow.
And I wasn't someone who really was affected by light and darkness, but boy, you wake up every morning and you're just like, where's where's the sun? And so I can imagine if you're already predisposed, that kind of situation will certainly make it worse. And I certainly understood why people are drinking a lot of coffee while they were
Yeah.
out there.
Yeah. And I've talked about with other people, and George and I were talking about it as well, like in Alaska, right, that has that very prolonged period of time where there's more night, right? But also the opposite in places that have prolonged day. And that also causes, for some people, psychosis, often in some kind of way. So I'm hearing you both say that it's part of our mental health, certainly related to mood, has to do with maintaining certain practices or routines. So is that mostly about sleep?
It's a big part of it, and it's interesting. It's sleep is one piece in terms of recovery and rest, but the other part is exercise, as far as stimulating your body, like getting both on a regular basis. The cycle between the two things is part of the healthy environment, and you can think of it like going back to earlier times, like we used to be active and hunting and out there, and this notion of being really active and then really resting was part of the way our bodies evolved over time, and trying to maintain a semblance of that in modern society, it can be challenging, especially where we spend our lives with artificial lighting, with computer screens, now with the phone screen, and it's pretty sedentary, right? When we want to hunt, we can just press on our Amazon app and have the food come to us versus us going out and chasing after it, right? So there's just a lot that's changed where today's modern living is not consistent with our biology, and then we have to find ways to kind of compensate for that and kind of activate the genes the way they were modeled over many years.
So advanced, but we have to think about the primal at the same time.
Yep.
Oh,
Yeah.
we're so interesting human beings.
Hmm.
I have two, well, one silly-ish question, but when you talk about seasonal affective disorder, both of you have talked about more depression-related symptoms. So, is anxiety impacted in any way, or is this strictly about it shows itself in some way in form of low mood, low energy?
Yeah, it's generally mood that we talk about, but when we talk about the biological changes that we're seeing, it can be both. Some people will experience depression, some people anxiety, some people experience both together. And what's interesting is the treatment that we typically go to is the same system that we're trying to activate that can present in all three ways. So yeah, each person manifests things a little differently.
Yeah, I'd agree with that. And interestingly, there's actually, and I can't think of the actual name of it, but there's a seasonal affective disorder that also occurs in the summer,
That
where,
was going to be my
where
next question.
so yeah, which I think is really fascinating. So yeah, so please, Robin, take it away.
No, that's it. I was going to, the simple question, is there such a thing as summertime seasonal affective disorder?
Yeah, there is. My understanding is it's a pretty low rate. It's not very common. I've seen, I think, one or two patients over the last 18 or 19 years that had a version of that. But that is really fascinating too, which just goes to show you that we're all individuals, and there's no one size fits all when it comes to, okay, it's dark, your serotonin goes down, you get depression. It's everyone's so different. And so we have to really think about that when we work with each person, as an individual, and say, okay, well, this is how things sometimes work, but is that how it is for this person? Or do we need to think outside the box?
Yeah, absolutely. Yeah, you have to look at what you have in front of you, and not just what the paper says you should have, and then put it all together.
Yeah, and that's what makes it, an art, right? Medicine is always called an art, not a science, the medical arts. And that's the reason why, because it's going to be different.
It is, but I think things are also arts until we understand the science.
Mm.
right? And I think that that's what we're seeing that's so powerful now with we talk about like genetics, epigenetics, is that's giving us more insights into the connections between what we saw where we didn't understand it, but through clinical practice you start seeing patterns that aren't in the literature but just make sense, and you get confirmation from your actual work. Now as we get more information, I think it gives us better data to then go back to some of the things that were art forms before and turn that more into science because we have deeper insights into it. So I think we're in that transition period right now, where we'll see a lot of that happening. And it's an exciting time to be in healthcare. It really is. It's going to be so different over the next few years from what it has been and what it is now. It's really kind of cool.
And I was a bit curious, Dr. Bongiorno, when you said, you moved from growing up in New York, you moved to Seattle for some time, and you kind of got a glimpse of what seasonal affective disorder could be. Now, do you think it's possible for someone who has lived in a particular region for their whole life and not have had seasonal affective disorder be triggered later in their life for whatever reason? Like, are there any triggers that can happen without, necessarily changing regions?
Yeah. So, I know we mentioned serotonin earlier as if, that was the focus. And that's a place to start maybe the conversation because that's something we all know about. But let's just think about serotonin for a second. So let's assume that when the body has normal levels of serotonin, people's mood is better. So the question is, well, what really affects it? There's so many things that affect it. Getting enough sleep certainly affects serotonin. Our stress levels certainly affect serotonin. When there's inflammation in the body, particularly coming from the digestive tract, that's going to affect serotonin levels. When there's low levels of nutrients, things like vitamin B6, even levels of iron, vitamin D, those are of zinc, those are all going to affect how well our bodies can make serotonin. In both women and men, estrogen levels are very important, especially in the central nervous system and in the brain, and that's going to affect the amount of serotonin that's made, as well as the effect of the availability of the receptors for serotonin. So when you think about it, there's a lot of factors involved in why one particular person might finally get affected. So you could talk about this person who maybe was on the fence or on the borderline with a few of those issues. And then, at age 40 something, they got some kind of major stressor in their life. And now they got depressed, and whereas they had never been depressed before. And you can look at the event and say, okay, well, that event is definitely what made them depressed. But was it really just the event? Or was that event what, the straw that broke the camel's back and really brought their resilience down to the point where now we're seeing the manifestation of mood? But really, it was those other underlying issues that brought them there. And then the stressor just sort of finished it off.
It's like a tipping point where in your body you have a convergence of all this information, all the different uh, parts that are coming in biochemically, and all those different factors that were mentioned. They all work to help your body function and metabolize all these different neurotransmitters and other products, and it's multiple things that go into it. So what's so fascinating about nature is how it has resilience, where multiple things work together to get to a certain goal, which is what sustains life. And that redundancy is what builds the resilience in biological systems. So it's not one thing that typically will break the system, but if you have multiple hits to that system, that's when things get thrown off. And that's why the fact that you have this change in light exposure, along with maybe some of these other factors, that's what eventually tips you over. And that's why maybe moving, it was contributed to these other changes that then the light impact is affecting you. So yeah, the biology of it's really interesting, how all the different pieces come together.
So, Dr. J, this actually, both of you, Dr. Bongiorno and you, talking about this. So that's kind of where my head is going. So, how do you know, and also, is it even important to know? But how do you know when someone has seasonal affective disorder as opposed to someone who has major depressive disorder or some other depression related diagnosis?
Well, you do a full evaluation, right? So we have a list of questions that we go through where we understand what do you meet criteria for. We look at the temporal dimensions of the experience. Like for example, it was mentioned, if is it related to an incident, right? So a mood response to an incident, then you're thinking maybe it's more of the adjustment disorder. So there are all these different components that go into our experience. So we kind of dissect that through a full clinical evaluation. But then our approach, it can be very similar regardless of how you got there. But the thing about seeing the pattern where it's consistently during the seasons where the light is decreased, that's when it gets into treatments like a light box, for example, where you wouldn't think of someone necessarily with major depressive disorder in the middle of the summer. You wouldn't think about giving them a light box. So they're depressed, but we don't see that as being a significant factor here. Based on all the information that we get and from the evaluation, we might conclude that yes, there's a seasonal component to this. Therefore, a light box would be a suitable, tool. But there are other things. We also use medications as well, like using like bupropion, which is very effective for people dealing with seasonal affective disorder.
Do you find it common for people to have seasonal affective disorder, throughout a period of time in the year, but not have any sort of other mood disorders or depression throughout the rest of the year?
Both types. There's some people who are depressed at other times of the year, but they always get depressed in the wintertime. And there's some people where they're fine, but they only get depressed in the winter. So you have all variations. Like Dr. Bongiorno was saying, like all those variances exist, and that's part of what makes the work fun. Is really helping people, to tease apart that information and to really help them understand what their experience is, so we can give them a comprehensive treatment plan that addresses their problems at the source.
So you talked, Dr. J, you brought up the light box. Um, I always laugh when I say that name because it sounds so rudimentary. Here's your light box for treatment. Do they really work? What is the effectiveness of that? And can you both talk about the light box? Like what is that? What kind of light and so on?
I've definitely seen it work. Sometimes it's not the only thing we need to do, but I've certainly seen pretty profound changes with just that as a monotherapy sometimes. And as far as the actual box itself, what I usually recommend if we're going to use a light box is using it's called a 10,000 lux LUX box. That should be the intensity at 30 inches. Is usually how it's described on the boxes. So I have patients look for 10,000 lux at 30 inches. If people are traveling a lot, they can get a smaller travel version, but sometimes they're not at that intensity. So that's been the intensity. As far as my understanding, it's been shown to work. That I've seen work in my practice, and usually what I recommend is people start with 10 minutes in the morning when they wake up, and use it for a couple days, 3 or 4 days, and then move up to 15 minutes. And then usually after a week or so, move up to 20 to 25 minutes, and try to use that every day. And they don't have to stare at the screen, but they just have to have it next to them, and you can read, you can work on your computer, you could do the things you need to do, but you just need a little bit of time in front of that box. Yeah, and I know some patients will ask, well, it's sunny where I am. Why can't I just go outside? And going outside in the morning, especially for circadian rhythm, is always a great idea. But because of that time of the year, the angle of the light that's hitting us and hitting our eye seems to make a big difference. So if you're at the equator, then I think it's probably okay. But if you're in those northern climes where typically seasonal affective disorder occurs, then that's where the light box will come in handy.
Besides the light box, do you think there's like, and I know in general it's ideal for us to eat healthy, get the right nutrients in our body, but specifically for like seasonal affective disorder, have you guys seen any foods or nutrients that you can take that can also assist in handling these feelings?
Yeah, well, certainly all the supportive measures that you would use, making sure patients are getting enough protein. Proteins break down to amino acids. Amino acids break down to the neurotransmitters that we need. So, the medications that we use are to help keep the neurotransmitters around, but we want to make sure the body's making the neurotransmitters so that this way the medications, if they're used, will help them stay around. So I think that's really important. Specifically, I like to use tryptophan. Tryptophan is an amino acid that becomes 5-hydroxytryptophan, which is actually another supplement. And then that 5-hydroxytryptophan becomes serotonin. And that's where you need things like vitamin B6 and vitamin D and zinc to help with that, and a few other cofactors. And then from that serotonin, that becomes melatonin. And Dr. J mentioned a little earlier the importance of melatonin in that pathway. So oftentimes when people are struggling to make enough serotonin, they're probably not making enough melatonin either. So sometimes giving them a little melatonin at night, to help their circadian rhythm, to help tell the body it's time to go to sleep, that can also be helpful too.
Yeah, and just that notion of nutrition, I think people sometimes like they gloss over it and assume that you have all the nutrients you need, but people don't, right? I mean, that's what we found. And when you give people nutrients and you let the body have the tools to do what it needs to do, it helps with whatever else you're doing. I mean, and I think the place where people get this idea is in the gym, right? They're going to the gym, they're trying to build muscle mass, and people take additional protein, additional nutrients to optimize the growth of their work from their workouts. They want to get muscular, they want to get strong, and so there we apply that concept. And all we're saying is, well, let's apply that in general, right? You want to optimize your health. Let's make sure that we give your body everything it needs to do what it needs to, and then we augment that with medication. So it doesn't remove the need for medication. It simply enhances what the medication can do.
That's a great analogy. I love that gym analogy. I'm going to use that.
Yeah.
Yeah, no, it makes
And,
so much sense, right? We think about it that way, but not in other ways, and makes
Yeah.
total sense.
and as a little side, because that question that Dr. Bongiorno said that people ask, why can't I just go outside? So people, I think, ask that about other things in relation to vitamin D. So
Yeah.
can you just talk a little bit about that also, like that vitamin D and sunshine, and why somebody might still need vitamin D in this situation, and but just in general, why, like, I'll go lay out in the sun, may not be enough.
I would say clothes, right? So most of your body's covered. Skin protection, right? So you see on your face, you're putting on moisturizer with sunblock built in, right? So you're limiting the level of exposure you're having for your body to use your skin to create the vitamin D that you need. And even after that's done, you can also even have a vitamin D receptor that affects how your body responds to whatever levels you have, where you might need even higher levels than other people. So all these different parts kind of combine to having people who can have a deficiency, where it's easy to get it replenished. It's easy to fix it.
During the summer months, when the sun is more direct, you can see, your skin gets a little bit on the red side, and when it starts to get red, the vitamin D conversion is starting. And it's not very common that we're out in the sun long enough to get that, and you do want to come back in before it gets too red, because then you create damage, and that predisposes us to other issues. And of course, people who've had skin cancers need to be more careful. um, but it's very hard to get enough vitamin D unless we're really out in the sun. And then depending on our own skin pigment, the darker our skin is, the harder it is to make that conversion as well. And then many of us, when we get out in the sun, we go in because we're sweaty and we take a shower. And believe it or not, if we don't stay, if we shower too soon, a lot of that conversion will actually go away. So if you're going out in the sun to get a conversion and you pink up and you come inside, give it a couple hours before you shower, because that will also lower the vitamin D conversion as well. And
That's mind blowing to me. Like I've never heard of that before.
yeah,
Me
I,
either.
Yeah, so it's so there's so many reasons why it's hard to get enough vitamin D, and then foods don't really have any vitamin D. Salmon has some, mushrooms have a little bit, but it's really hard to get an appreciable amount of vitamin D from food. So if we're not getting it from nature, from the sun, then we do need to supplement with that to in order to raise those levels, and we need those levels. Vitamin D is an important cofactor for serotonin. It's really important for our cardiovascular system. It's important for how the body balances inflammation. So there's so many necessities of vitamin D in our brain and our lives. I know there was a new study that came out. I haven't read it yet regarding the importance of vitamin D in depression. I don't know, Dr. J, did you get a chance to see that?
I don't know which one in particular you're referring to. And again, it's been mixed.
Mhm.
So there are a lot of studies when they look at it, they're saying, "Wow, there's no connection between the vitamin D and other
Mm.
clinical issues." But I think there are nuances to the story, and I think it's not conclusive. But we have these ranges that we consider to be normal. If you're out of that normal range, it probably behooves you to get into the normal range. There's a reason that we say that it's a normal level, and but we've gotten somehow comfortable with this notion of being deficient, and because we don't see overt clinical signs, we say it's okay. But then there are other issues that the person could have, and I think eventually we will make a better connection to understand the full value of making sure that all your nutrients are in the proper range. I think that that's something that we'll get to.
And at the risk of sounding, I don't know, maybe not so smart, I and never thought of the entire body, like how you were saying before, Dr. J, that we're covered with clothes. Because in my mind, I always thought it was through the eyes. I'm sorry, but I did. I thought, oh, I'll look at the sun,
Okay.
and I think that's what a lot of people think. I don't
Mm.
think people are thinking that it requires like body absorption. It's not. It's not based on, oh, I'm going to sit here and just stare at the sun for 20 minutes or something, and that somehow the eyes are the quickest way to the brain and to fix all of these things. So it was interesting to know that. I have to laugh at myself because I definitely thought that that was true.
Mm. Yeah.
And I'm sure a lot of people, probably thought the same thing or aren't sure. But the skin is the biggest organ in your body. What you goes on your skin gets absorbed. Like when you put on deodorant, that's getting absorbed. When you shampoo, whatever's in that shampoo is being absorbed. When you put on makeup, that's also getting into your system, and that's why like there was a recent report about people using like agents that like lighten the skin, and they were getting mercury poisoning from those products, right? And the skin is a dynamic system, and vitamin D is one of the many things that it does.
Yeah, and I mean that's I think also was interesting, and just because of my own personal things that happened in my life, the discovery right of the aluminum that's in deodorants is a correlating factor with several different types of dementia, if not
Yeah.
all of them. And
Yeah.
and again, it's because I think people don't think, well, I just put it on my underarm. You're not imagining that these things are going throughout your entire system, throughout your body, head to toe. Um, I don't want our time to be over before I ask you about this. Um, we read that women are more likely to experience seasonal affective disorder than men. Is that true? And if it's true, why might that be?
I think it is true, at least from what I've seen in my practice. I'd have to look at the statistics. Um, and that might be true for a couple of reasons. Is it possible that maybe women report it more than men do? Men tend to kind of keep things in and pretend that we're okay when we're not. So that could be a part of it. It could also be that connection to estrogen that I mentioned earlier, because there's a lot more fluctuations in estrogen. Men have, I think, upwards of 30 times more estrogen in their brain than women. So there might be more stability there in terms of serotonin production. So that could be a possibility as well. I also know, from just seeing many patients over the years, that typically women are more susceptible to low iron levels. And I think low iron levels can also play a role in other changes that'll make people susceptible to depression. So that could be part of it as well.
Yeah, and even wearing more sunblock, it could be something as simple as that. Like
Mm,
men may not be putting on those moisturizers with sunblock, and women are. I think it's something, whatever that pattern is. I haven't looked closely at that data.
Hmm.
It'll be an interesting thing for us to kind of look at more and see if we can figure out what the connection is. But I'm not sure what it is.
yeah, it's a great
I feel
question.
I feel like both of you brought up so many things that I would love to talk more about. Like men have more estrogen in their brain than women. Like I want to know about that because I have lots of thoughts about it. But that's for maybe another time. Hey George, you know what I want to ask you? So you moved from the East Coast and now you're in the Southwest. So more sun for you. It's still light for you, right? At 4:30 or 5 o'clock. So have you noticed a difference for yourself in any way?
For myself, at this point, I definitely feel more energized. I would say, and just because I mean, the East Coast is difficult sometimes when starts hitting 4:30, 5 o'clock, and it's dark. And for myself, I've never been diagnosed with seasonal affective disorder, but I've always, felt during this time of year, I felt a little bit more down, a little bit. It was a little harder to do things, so at this point, I do feel a bit better,
Good.
just getting some more sun, and then just not being so dark as early. Because for me personally, that was just like as soon as I went outside, it's 4:30, 5 o'clock, and it was dark. I
Hmm.
just felt it in my body and my soul. Oh my God, it's dark already. But yeah, like as of now, everything's going good. And I did have just one more question also for you guys. And around this time, do you think like because we're talking a lot about serotonin, physiological effects, vitamin D, etc. Do you think there's any connection with and not, I know not everybody celebrates the holidays, but a lot of people do celebrate the holidays. Do you think there's any correlation between seasonal affective disorder and the holiday season?
Yeah.
Financial struggles, nostalgia, etc.
Yeah, I mean there could be, but we would put those as adjustment disorders. So stressors in your life that are affecting your mood definitely could be a significant contributor to the problem. Um, but I think again through an extensive, detailed evaluation, we're able to kind of parse that out, and see like what are the connections between what's going on in your life and what you're feeling, and then how that kind of coalesces around some particular diagnosis or diagnoses.
Yeah. Additionally, I was thinking as you asked that question, when you think about the bear that should be hibernating, yeah, just go into that cave and ask that bear to put on a tie and go out and go buy presents for people and get to a party and then eat a lot of food that maybe is not so healthy for it and and then do it again the next night and then go back to work for a couple of days and then go do more of that. It is stressful. So I could see why, if somebody's already predisposed that, we're asking people to be their most outgoing and to be the most everything and get as little sleep as possible at the time of the year. We want to really do the exact opposite. So it's hard.
I have one final question for you, Dr. J. Do you think that we've made a case here during this podcast of why maybe we should all have off during this time and that we don't have to work, that we could
Yeah,
hibernate for several months?
I think we made a case. I don't know how much support we're going to have for that case. Yeah, that's a good case.
Oh,
I'm sorry, I cracked myself up.
I like
Um, I thought I was making a really good segue, but what I also do want to say is that all of this information that both you, Dr. J, and you, Dr. B, bought is what makes being at SohoMD so great. Is that looking at things from all these different perspectives that really incorporates everything. Because when we were talking before, I thought, so for seasonal affective disorder, talk therapy, I'm a therapist, not the thing. It's not the thing. But if there are other things like you were saying earlier, like kind of like the straw that broke the camel's back, so to speak. But that's one thing. But if it's strictly about seasonal affective disorder, that all of these other methods are more effective, and we want to be able to offer these things. So it's great, and I don't think that that's typical. This is shout out to SohoMD.
Well, thank you for being on for today.
Thanks for having us.
Yeah, it's definitely going to be a great resource for people to use in the future. So look forward to having you guys on again. You're becoming a popular duo here in the podcast.
Yes,
Awesome.
thank you
My
so
pleasure.
much. And I'll probably be reaching out to both of you to discuss my personal evening issues. So thank you very much. I appreciate
We're here for you.
it.
We're here for you.
Thanks, guys.
All right, thank you.
Bye.
Bye.
Bye bye.